Good morning. Good Friday morning to you. My name is Julie Hirschberg, the founder, owner of Reactive Therapy and Wellness here in the Los Angeles area, and also home to the Schmidt Movement Disorder Fellowship, which is a fellowship program for physical therapists to specialize in movement disorders, which is one of the reasons why I am so passionate about functional movement disorders, our topic for today. And thank you so much for joining me, learning with me, helping me learn and grow. I've learned a lot through the community that we have of physical therapists and occupational therapists and psychologists and physicians and people with functional movement disorders. So thank you for joining me. Today we are talking about the top 10 myths about functional movement disorders. And despite functional neurologic disorders, the big umbrella, being the second most common diagnosis in a neurology office, many myths persist in the healthcare field. Things like it's all in your head, or you're faking it, or it's just stress, it's just psychological. And this is so frustrating. This is frustrating that many healthcare providers still believe these myths, even though there is a huge wealth of research that has come out over the last 10 years to dispel them. And so we're going to be myth busting today and talking through these top 10 myths. By the way, I was inspired by a great little article. I'll see if I could put this in the comments. It was a letter to the editor in the European Journal of Neurology in 2020. By several great neurologists who work with movement disorders, and it was 10 myths about functional neurologic disorder. Great little article. I recommend it. And I was inspired by it and added to it some of the things that I hear a lot. So we're going to start with this and talk about why, like, our mission as healthcare providers should be to dispel a lot of these myths, and how some of the facts versus fiction here really point to an interdisciplinary program to restore connection and promote recovery in functional movement disorders. So thanks again for joining me this morning. It's not our usual time for a Facebook Live, so I'm really thankful that you're here. And let's start with the myth busting. So myth number one about functional movement disorders is that it's all psychological. Now, if you look at the history of functional movement disorders, way back in the 1800s, as hysteria, as and then conversion disorder. So this was something that Freud really promoted, into like a somatoform disorder, a psychogenic disorder. And it really wasn't until the last 20 years or so that this idea of a functional movement disorder came to be. And so there's a history there that this was considered all psychological, but that was before we could do things like functional MRI imaging and advanced electrophysiologic studies to show that it's not all psychological. And now that wealth of information shows that it's this complex interaction of psychological, yes, there's a contributing factor there, physical, sensory, motor control, lifestyle factors, autonomic influences that contribute to functional movement disorders. By the way, we put those all into like a pie chart. It's my favorite thing to do, is create a pie chart and look at all those contributing factors together. So it's not all psychological. That is a myth. The second myth, which really fits with this, is that then treatment for functional movement disorders is entirely psychological. Many times when people go to a neurologist's office and get diagnosed, they get a referral to a psychiatrist or a psychologist and nothing else. And this is despite the fact and the evidence in the literature showing that physical therapy, occupational therapy, speech therapy, interdisciplinary programs are highly effective in functional movement disorders. This is why we run our own interdisciplinary program. There's been great studies that show inpatient, outpatient, intensive programs are very effective in helping people with functional movement disorders. Now, do they include psychology? Absolutely. But when we're looking at a disorder that affects that connection between the brain and the body, we need to include the physical components as well and working together, which I love to do. I love working with our neuropsychologists and other providers to really provide that holistic care. So important, and we need to advocate for that for our patients. Myth number 3, this is another favorite of mine, that functional movement disorders are a diagnosis of exclusion, meaning we've ruled out everything else, so it must be this. And it's like a grab bag or a garbage kind of bag term of like, well, it's not anything else, so it must be functional movement disorder. And that is not the case. Functional movement disorder diagnosis is now really clearly based on positive clinical findings. So just like Parkinson's disease is a clinical diagnosis, functional movement disorders is a clinical diagnosis based on positive findings like Hoover test and the entrainment test and many more now that have been studied to be reliable, valid, have good sensitivity and specificity. And I always advocate for this for many people who ask me, like, do I have this? Is finding a movement disorder specialist who understands functional movement disorders and not only can rule out other things, but give a positive rule-in diagnosis of a functional movement disorder. So important. So if you're a person with functional movement disorder, you want to provide or find that provider that can give you that positive diagnosis. Okay, that was myth number 3. Myth number 4 is that functional movement disorders is all in your head. You're making it up, you're faking it, it's entirely voluntary. And this is probably the most despised myth. This is where I get on my soapbox, because when people see unusual movements or variable movement problems, many healthcare providers don't know how to understand it. It looks odd, and they may assume that the person is faking it or they're voluntarily moving that way. And this is a big no, that is not the case. In fact, functional MRI imaging studies show that there's a distinct difference, a pattern of activation in the brain when somebody is faking paralysis versus having a functional paralysis. It's very, very different. And if you caught my video last week about deadaptation, this was motor deadaptation is another sign that occurs in a functional movement disorder that would be impossible to be faked or voluntary. By the way, if you like these videos, join our newsletter, and I send out a little summary with all of our videos every week and resources. I have a ton of resources this week of articles and videos and websites that I love in this topic, so join our newsletter. But FMD is not in your head. Okay, myth number 5. This is a good one too. Really interesting. Many people think, well, you have a functional movement disorder or you have another disorder. Not both. And what is really interesting in the literature is that often people do have both. And the presence of another neurologic condition is actually a risk factor for the development of a functional movement disorder. And they commonly occur together. There's literature to show that they commonly occur in Parkinson's, in migraine after surgical procedures. So this is something that is not an exclusion, and it does mean a very skilled neurologist, movement disorder specialist to try to look at screening for both at the same time. So they're not mutually exclusive. And it doesn't mean that people shouldn't have imaging and other workup because they can co-occur together. Okay, myth number 6. Different symptoms equal different disorders. So we see a lot of different types of functional movement disorders, tremor and dystonia, paralysis, for example. And many people have thought that those are actually different things. And it turns out that when we look at some of the underlying mechanisms and fMRI, that there's actually a lot of similarities, that these are maybe different phenotypes or variable expressions of the same underlying disorder. So just like Parkinson's can look different to different people, or MS can look different, so can a functional neurologic disorder. And there are a lot of things that are common underlying all of these different phenotypes, things like pain and fatigue and even cognitive symptoms that we see in all of these syndromes. So different symptoms do not equal different disorders. That was myth number 6. Moving on to myth number 7. This is a really interesting one that was in that paper by John Stone and colleagues